Recognize Senator Elizabeth Steiner, Hayward, please.
Thank you, Mr. President. Colleagues, I bring to your attention Senate Bill 420. This bill is a fairly straightforward bill, and it's basically about empowering and educating women about an important and potentially dangerous health condition. When women have a mammogram, the most commonly used test for screening for breast cancer, mammograms can have reduced effectiveness, reduced ability to detect breast cancer when a woman has what's known as dense breast tissue. And up to 40% of women have dense breast tissue. Now, not only does dense breast tissue make it harder to detect cancer on a mammogram, it also increases the risk of a woman developing breast cancer. So it's harder to find, and she's more likely to have it. Not a good combination. Unfortunately, the vast majority of women don't know their breast density, nor do they know that they have dense breasts at all, nor do they know that it decreases the effectiveness of the mammogram in screening and increases their risk of cancer. Furthermore, exactly what we do for screening for this problem to increase screening is not officially decided, but we do know that we need to educate women and empower them so that they can be active partners with their health care providers. Senate Bill 420 has a fairly simple requirement, and it requires that health facilities that perform mammograms notify patients when their mammogram demonstrates dense breast tissue by adding a statement to the notice they already send out. Mind you, this does not increase their costs at all because they are already required by law, federal law, to send a notification to a woman of her mammogram results. The Oregon Health Authority will define dense breast tissue according to the best medical evidence and determine by rule what will be included in the notice. It specifies that the notice should include information about dense breast tissue, an explanation that dense breast tissue can be associated with an increased risk of breast cancer and, unfortunately, lower rates of detection of breast cancer by mammogram, an explanation that patients with dense breast tissue may benefit from supplementary screening or diagnostic testing, and a recommendation that the patient contact their primary health care provider to discuss their options for further screening. This is simply an education bill, colleagues. I have seen too many women go for mammograms year after year, only find out later that they had a breast cancer hidden in their dense tissue, which no one ever told her that she couldn't find. And you'll hear one of these stories from my co-carrier when she closes. And these women have been brave enough to come tell us their stories and point out that if they had known, they could have been more active partners in their own health care. Success in breast cancer treatment depends on detecting it early. If we can't find it, if we don't screen for it properly, we can't detect it until it's later, harder to treat, and much more dangerous. I encourage your support for Senate Bill 420. Thank you.
Discussion of the measure which is now before us. Senator Jackie Dingfelder, your closing, please.
Thank you, Mr. President. Colleagues, as you've heard, Senate Bill 420 seeks to raise awareness and educate women about dense breast tissue. And I want to thank my good colleague from the most diverse district in Oregon for her guidance on this bill, as my staff and I have been working on this for over a year, which seems like a long time, but it is, and it looks like a simple bill, but this is a complex issue. The bill will allow women to better understand the risks they face of getting breast cancer and to understand the limits of mammography. It will also prevent more stories like Miss Laura Caldwell, who thought she was doing everything she needed to, and still the doctor missed her cancer for 2 years. When Miss Caldwell asked her doctor why mammograms hadn't caught her tumor, the doctor informed her that she had dense breast tissue, and that tumors just didn't show up as easily on mammograms on women with dense breast tissue. When Laura questioned the doctor further about why she had never been told that she had dense breast tissue, he replied, "We don't usually tell women that information." In 2012, Laura completed her treatment and went into remission last March. However, earlier this year, just a week before Senate Bill 420 was scheduled for a public hearing in the Senate Health Care Committee, Laura's doctors discovered another tumor, this time in her brain. Doctors believe it is most likely the breast cancer that went undetected for over 2 years. Only a week after traveling from Eugene with her family to testify in support of Senate Bill 420, Laura underwent brain surgery to remove this new tumor. While the doctors were able to remove the tumor, the doctors have said that Laura's cancer had a 70 to 80% chance of reoccurring and that the prognosis is not good. Colleagues, we all know that early detection of cancers, including breast cancer, greatly increases a patient's chance of survival. Part of early detection is informing a patient of their personal risk of developing cancer. So this bill will increase early detection by ensuring women have a better understanding of their individual risk of developing breast cancer. I urge your support for this bill, and that it will help save lives by educating women about their risks and make them aware of alternatives to mammography. By passing this bill, we will increase early detection of breast cancer and hopefully improve survival rates that will ultimately save lives. There is no known opposition to this bill. It passed out of the Senate Health Care and Human Services Committee unanimously, and I urge your aye vote. Thank you.